Can isometric exercises be a key to unlocking your autonomic nervous system and improving your blood pressure? Blood pressure is one of our most important health metrics, and we traditionally associate it with the health of your cardiovascular system, meaning your blood vessels and your heart. But in reality, it's also an important metric of your autonomic nervous system. Not only is hypertension associated with increased risk for stroke, but even if you don't have a stroke, the small vessel disease that occurs with hypertension puts a lot of people at a higher risk for cognitive impairment and dementia. Exercise has always been an important part of blood pressure management, with most exercise recommendations going towards increasing cardiovascular activity in the form of walking, jogging, endurance type of exercise. But recent meta-analysis and review of exercise interventions for blood pressure actually found a surprising result in that of all the pooled studies regarding aerobic training, strength training, the one with the strongest improvements in blood pressure was actually focused on isometric exercise training. An isometric contraction is basically when someone does a contraction of muscle, but the length of the muscle doesn't change. So a classic example that we're going to talk about today is something called a wall squat, where someone goes against the wall, they get into a squatted position, they actually have to hold that position in place for the entire duration of the contraction. And that contraction can take place over the course of several seconds, up to a couple minutes at a time. The literature primarily looked at 3 different styles of isometric exercise: the wall squat, the leg extension, and the isometric hand grip strength test. And all 3 of them showed pretty consistent reductions in blood pressure. Even though these exercises have vastly different stressors on large versus small muscles, they produce fairly comparable changes in systolic and diastolic blood pressure, which is pretty interesting. The general idea is that if you do a sustained isometric contraction of about 2 minutes, and you do that in intervals for 4 times, and you do that 3 times per week, then you could get a sustained drop in blood pressure ranging from 8 to 11 millimeters of mercury in your systolic and 4 to 5 millimeters of mercury in your diastolic blood pressure. After 8 to 12 weeks of consistent training, people could actually maintain these changes in their blood pressure by reducing the frequency of isometrics down to just 1 time per week. However, it's unclear to see if this might be something that can be altered with neuroplasticity by training isometrics for a longer period of time and seeing if plasticity might help you maintain those changes over a long enough duration, since most studies are done in the short term. All forms of physical activity, including strength training, aerobic training, and isometric training, all improve blood pressure through some combination of improving baroreceptor sensitivity, cardiac remodeling, and changing total peripheral resistance. But what happens that is unique to isometric training is a bit unclear. During an isometric contraction, you're going to squeeze these muscles, which is going to put a stress on the blood vessels that increases your heart rate, and it's also going to increase total blood pressure during the contraction itself. When you have the relaxation phase, there's an acute rush of blood flow called reperfusion that is going to go back into those blood vessels and into the little capillaries, and it's going to create these shear stressors on the vascular endothelium. From my neurology bias, my suspicion is that a lot of these changes are probably more to do with the changes in your autonomic nervous system function more so than the blood vessels themselves. That's because the vast majority of these studies involve doing something called a hand grip test, where you're squeezing just these small muscles in your hands in order to hold the isometric. And with the hand grip test, you're really only changing the muscle and the blood vessels around a small group of muscles surrounding the hand, but you're getting these really strong global changes throughout your body as a whole. While hand grip training might only train the muscles and blood vessels of the hand, the activation of those muscles and the sustained contraction of those muscles puts a high demand on the sympathetic nervous system. And by using intervals to stimulate the sympathetic nervous system and force the sympathetic nervous system to relax and recover, I believe it's making our sympathetic nervous system more adaptable, so it has more access to change the tone of the blood vessels throughout the entire body and not just the hand itself. And that's where we're getting the benefit from a lot of these isometric type of training practices.